Now, cancer treatment varies depending on the stage. If we're talking about an early stage, the main treatments are surgery and radiotherapy. For metastatic cases beyond the local area, the main treatment is systemic therapies. When we talk about systemic therapy, we're referring to chemotherapy, targeted therapy, immunotherapy, hormone treatments, and sometimes radionuclide and radioactive therapies, all of which make up oncological systemic treatments. Sometimes, we can also use systemic therapies at an early stage, either before surgery or after surgery. If we anticipate that there is a high risk of a cancer recurring after surgery, the treatments we give following surgery are called adjuvant therapy. Sometimes, before surgery, we can also give systemic therapies called neoadjuvant treatments to shrink the tumor, to reduce the risk of micrometastasis if it's an aggressive tumor, and to allow for a more cosmetic and better surgery. But we also use systemic therapy in advanced disease. Our goal there is to reduce tumor-related symptoms, to extend the patient's lifespan, and to slow the progression of the tumor, so we can also administer these treatments in advanced stages. Now, we apply all treatments that fall under the scope of systemic therapy: chemotherapy, immunotherapy, targeted therapy, endocrine therapy, radionuclide therapies. Sometimes these treatments are given alone or in combination, depending on the patient's needs and the stage of the disease. We are able to offer all of these treatments to our patients. Immunotherapy. Actually, there are two approaches in oncological treatments. One targets the cancer cell itself, and the other targets the immune system. When we talk about immunotherapy, we mean treatments that help immune cells recognize cancer cells better and destroy them more easily. Immunotherapies are actually not just a single method. There are various types of immunotherapy. These can be treatments that stimulate T cells to directly fight cancer, or sometimes, cells that directly fight cancer can be given passively to the patient. Sometimes, they can be administered in the form of vaccine treatments. All of these can be considered under the umbrella of immunotherapy. But the main point is that we call treatments targeting the immune system immunotherapy. Melanoma, kidney cancer, and lung cancer are the cancers where we most frequently use these treatments. Targeted therapy, unlike chemotherapy, is a treatment that targets cancer cells, similar to chemotherapy. There are specific targets in some cancers. For example, in certain cancers, like EGFR in lung cancer, BRAF in melanoma, or HER2 in breast cancer, there are specific targets. These are cancer-specific targets that shouldn't be present in normal tissues. The treatments we give specifically for those are called targeted therapies. This can be done for every type of cancer, but in some cancers, there are well-known targets. In many cancers, like lung cancer, breast cancer, colon cancer, and melanoma, targeted therapies also have a place.